Hello, I'm Jeremy Fernandez. Welcome to our weekly live stream to take your questions about coronavirus. How do we cope with it? How's the nation doing? And what does the future hold? Joining me today on the program is Associate Professor Dr. Hassan Vally from Trobe University. He's an epidemiologist and Senior Lecturer in Public Health. Also with us is the ABC's National Medical Reporter, Sophie. Scott, welcome to both of you.
Welcome, Jeremy.
Now, we're taking your questions, as we say, on coronavirus. No question too great or too weak, so leave them in the comments below. In fact, we've already received thousands of questions over the course of the week, a lot of them to do with isolation and what things we can and can't do, and also the news this week that in some states they're announcing some plans to go back to school, for students to go back to school. What does that mean for the kids? What does it mean for the teachers and families? So let's kick it off, as we do every week, with asking this question, Dr. Hassan Vally. How are we doing with this national curve? How does it look right now?
Look, I think we're doing really well. I think the signs are fantastic, and we're doing as well as we could have expected to have been doing at this point. I guess the only point to make about it all is that if this was a football match, I don't think we're at half-time yet. I think we've still got a way to go, and a lot of the gains that we've seen are as a result of the border controls and the reduction in the amount of imported cases, and also our effective control of clusters. And so we're going to learn a lot in the next month. We're going to find out a lot more about community transmission. And so we have to hang tight and stick the path for the next month. And then hopefully we'll start to see the easing of restrictions.
Sophie, how great is the threat of community transmission? Now that we've closed the borders, overseas cases are not the great threat they once were. So what about community transmissions?
Well, I think we've seen what's happened in northwestern Tasmania, where community transmission still is a real risk because this virus is just so contagious that it can spread so easily amongst groups of people. And that's a really good example of how we're dealing with community transmission in putting a lot of resources into that area, effectively locking down those communities. But it also is a bit of a warning and a wake-up call that we can't be complacent with the good numbers. We do, Dr. Vally's right, we do have excellent numbers at the moment, but if we allowed community transmission like we're seeing in northwestern Tasmania to happen in other parts of Australia, then things could quite easily turn around. And so there's certainly no room to be complacent at the moment.
We got this question from Wayne Upton through our Facebook page. Wayne, thank you for your question. He asks, where does the government data come from and who is giving the government advice, and how reliable is that advice? Dr. Vally.
Look, it's a very good question. So we have one of the best public health systems in the world, and we have public health departments that are attached to each of the health departments, and these are the people that do all of the routine disease surveillance and respond to infectious diseases. So they're the people that are working incredibly hard at this point in time. I've actually just come from the health department this morning, and they're waking up at 5 o'clock every morning to get the data to the appropriate people by 7:30, and then they're working through the night. So these guys are working incredibly hard to make sure that we have the best possible data to inform our public health decisions. And in terms of the expertise, I also think we've got basically the most experienced public health experts that are advising both the federal government and the various state governments. And I know a lot of these people personally, and it really is the cream of the crop that are advising all of these governments.
Sophie, how does Australia compare when it comes to the sort of expertise we can draw on compared to other parts of the world?
Oh yeah, look, Dr. Vally's right. We have world-leading experts here, and we're also very well served by our chief medical officers in each state and territory, and also the federal chief medical officer, Professor Brendan Murphy, and his deputies that they've now appointed as well. So those public health units are doing an amazing job. They feed that information to the chief medical officers, and they all get together as a group with Professor Brendan Murphy and look at the evidence, and it's their recommendations through that committee that they all sit on that's going to the National Cabinet, which is driving policy. So we're extremely lucky to have the quality of the calibre of researchers and public health experts we have here in Australia. And we're also lucky that the authorities are listening to the experts as well. So it's all well and good to have good advice, but if people don't act on that advice, then it's not very helpful. But so we've seen the best of both worlds, not only good quality medical advice, but then governments putting that into action, and then the community following that advice for the most part. So it's been a big success story, and you only have to look at the numbers to see how well Australia is doing compared to other countries around the world, with our number of cases and with our death rate, just to see that, you know, we have had good advice, we have acted, and the community's really got on board. And so far, we need to just stay the course now. We need to just stick with it, even though, you know, the Prime Minister's mentioned the 4-week period where we might review things in 4 weeks, but we still need to stay the course in the next couple of weeks and then see what happens.
We've had a lot of questions about isolation, what that means. People obviously coming to terms with what they can and can't do in the circumstances, what constitutes essential and non-essential travel or gatherings. This question is from Rebecca. Can my family travel and congregate in the same house or office to address a family death or probate or legal issues around her father's estate? Police haven't been able to offer any guarantees about how lawful that would be. So she asks, where can I go for advice? Sophie?
Well, look, I think the answer is that it would probably depend on the state and territory. Some state and territories have been very, very cautious and actually pulling people over in the car to say, where are you going? And, you know, why are you out travelling? It would be safer for all involved if they could do it as a virtual conference and just get onto a video streaming service and do it as like a FaceTime or a Zoom or some other way like that. That way, that's going to minimise the risk that, you know, because the thing about that scenario is that someone in that family might have the virus and not have any symptoms whatsoever. And then by having that group meeting, they're then putting everyone at that group at risk of contracting it. So if there is an alternative, which there is, to do it as a virtual meeting, then that way you're not going to be putting anyone in that group at risk. So I think it's better to err on the side of caution and to not have a meeting in person.
Dr. Vally, can I get your take on that?
Yeah, look, firstly, I was glad you asked Sophie first, because that was a very difficult question. I think we're being asked to do very challenging things at this time. And, you know, this is one of those situations where, as Sophie pointed out, there are risks associated with coming together. And I know in Victoria, the messaging is very clear. There are only 4 reasons why you should be leaving the house. So it's very tough, but the consequences of something going wrong in that situation could be quite significant. And then there's the broader question of, if you allow that to happen, where do you draw the line? So I just think it's a very, very difficult time, and we just have to navigate it as best as we can.
So this question comes from Amber Gleitz. Amber asks, if family members across 2 households practice strict self-isolation for 2 weeks, so no contact with anyone, not leaving the house, can those 2 families then come together? Sophie?
Look, that was a really tricky question. I thought about this before coming on and did a bit of research, and it's difficult to say yes or no, other than the fact that we've been told that we have to maintain distance from people, whether those people have been practicing social distancing themselves or not. So we need to abide by the guidelines that we've been given, and the guidelines don't allow for that sort of gathering to take place. Even though you might say, well, it's a fairly low risk. Those, you know, people in one household haven't been anywhere, they're not sick. People in the other household haven't been anywhere and they're not sick. But I guess it's like, well, what happens if they, you know, have a car accident on the way to the gathering or something unexpected? And we really do need to stick to these strict excuses. The only way you should really be going out is for food, medical care, to care for someone else, or to go to work. And that doesn't fit into that scenario that the question has asked about.
So, Dr. Vally, again, we come across this principle that the risk is posed not from isolation, but by the transit in breaking that isolation. So these 2 families coming together may be safe in their own homes, but as soon as they start moving, that's where the risk enters the equation, doesn't it?
Yeah, absolutely. But also it represents a larger group of people. So if disease, you know, invades that group, or someone in that group is exposed to disease, then it's a bigger challenge for the health department to do its contact tracing, because presumably those two family groups aren't going to be in 100% isolation. People are going to come into contact with other people, and then you've got all of a sudden things escalate. So yeah, you just have to draw the line somewhere, and it is, we have to acknowledge it's very tough.
Dr. Vally, at this time, a lot of people are sort of tossing up how to deal with isolation versus continuing to earn an income. Rebecca Moffat asks this question: is it safe for residential cleaners to still be working, especially when they go in and out of multiple properties? And how much should those cleaners consider their own underlying health issues?
Look, it's a good question, and I think there's two parts to that. So firstly, anyone that has underlying health issues and who is at greater risk of severe disease, they should be looking after themselves quite carefully. And I think the governments of the states and territories, as well as the federal government, have given good advice for those people as to what they should and shouldn't be doing in terms of what's a reasonable exposure. In terms of cleaners doing their job, I think if you practice social distancing and good hygiene and follow all of the guidelines that have been very well communicated, I feel like you can keep doing your job. But, there's no one can be 100% risk-free. It doesn't matter what you do. It doesn't matter whether you do stay at home but just pop down to the shops. There's a little bit of risk associated with all of our activities, and what we're trying to do is we're trying to manage the risk.
Sophie, can I get your view on how that works for Rebecca Moffat and the question of cleaners going in and out of houses?
Look, it is a difficult question, and certainly you would want to look at the health status of the cleaner first up to see if they were at increased risk themselves. So if they were, say, in an older age group, if they were had any pre-existing health issues that might predispose them to be more at risk, then the answer for them would probably be you're better off not to do it. But then, yeah, taking any precautions possible. So, for example, the cleaners could wear a mask. They could use gloves that they only use, for example, that they use a new set of gloves at every different house that they go into, and then dispose of the gloves when they leave that house. But it's a balancing act, because obviously people want to maintain an income, but then they need to also maintain their own health and safety, not only for themselves, but also making sure that they're not spreading it to the houses that they're going into as well. So probably ensuring that they can take every precaution possible for themselves and for the properties that they're going into as well.
Okay, we've had a lot of questions, people asking about the return to school in the coming term. Some states have announced their plans on how this is going to be phased in. And so I'm going to fire through a number of questions here. JL, who's reached us on Facebook, asks, what is the actual research, scientific, not economic, guiding the decisions on going back to school? Janine Healy-Meldrum points to a number of coronavirus infections in children and teenagers, and it makes her wonder about how safe it is to go to school and whether children are spreaders. Dr. Vally.
This is probably the toughest question, I think, to answer. And so I'll say a few things. Firstly, it makes a kind of intuitive sense to people for children not to be going to schools. It just feels right, given all of the other sacrifices that we've had to make. But the question that's been asked is a really good one. If you can step back from that gut feel that you have that, we shouldn't be going to schools because that brings people together, what does the evidence actually say? And it's really interesting because the evidence probably comes from three sources. There's evidence that we've obtained from previous influenza pandemics and epidemics. There's evidence from SARS and MERS and modelling that's been done around that. And then, of course, there's evidence from what has actually happened, over the last 3 or 4 months around the world. And the really interesting thing is, when you look at the evidence, the actual evidence, now there's obviously a little bit of contention there and it's a bit messy, but a lot of it pretty much says that there is only a marginal benefit that you get from closing schools, but that comes at a massive cost. So it comes at a massive economic cost, a massive social disruption cost, maybe a cost to the health system with essential workers not being able to go into work. And of course, there's the educational cost. So you can see why this is such a difficult policy parameter for governments to deal with, because on the one hand, there's a gut feel that we should be closing schools just to eliminate as much risk as possible, but the evidence is pretty marginal. And so a lot of it's going to depend on the price that a government is willing to pay to stop the extra cases. It's an incredibly difficult question.
So, Sophie, a lot of teachers are saying that they're being put on the front line here because of this decision to return to school. What advice do you have for teachers who may be looking at going back to work in term 2?
So I think it's right, and the authorities, it is that thing where your gut feeling is, well, we should be keeping kids home. If we have to stay home, we should be keeping kids home. But Dr. Vally's right, the evidence is really not as clear cut. So the thing about teachers, though, is that it becomes a work safety issue for teachers because older people are more at risk, and we do have older people working as teachers that we really value. But the reality is for them that there is an increased risk of them being put into that situation with other adults who may have the virus and who may not know it. So I think teachers, particularly ones who are maybe 65 or older, who have other pre-existing health conditions, they're the ones that probably need to think carefully about whether they feel safe and happy to go back into that environment, whether they would rather do some either work from home, or if there is some tele sort of schooling offered, whether they could be part of that. So it's not a clear-cut answer for teachers, because the risk for some teachers is greater than for other teachers. So it's not so easy just to sort of have one quick answer for teachers.
Dr. Vally, is there an inconsistency in the health communication here when you're telling people that they need to be very guarded about how they go to parks, you're not allowed to see your grandparents, and seeing friends is completely disallowed? Sandra McQuillan and Tanisha Bolger both asked this question. Do you see those other restrictions having to ease as well to keep some sense of consistency between what people are being asked to do?
Yeah, look, what an excellent question. I think this is one of the challenges, because people like consistency, and it's easier to communicate a consistent set of parameters, if you like, for this social restriction. But, you know, we're sort of trying to thread the needle here. We're trying to flatten the curve and reduce transmission. And I think what the governments are trying to do are balance the benefits of various activities against the other costs. And obviously the economy has been talked about a lot, but there's also social disruption costs and mental health costs and various other costs. So when you do that equation on a case-by-case basis, it can feel a little bit inconsistent, and I think people don't like that. And I think we certainly can always communicate better, and the government should work harder at making sure that message is very clear as to the reasoning behind their decision making. But I don't envy them. It's just such a difficult thing to try and implement all these range of measures, and people are going to get confused. So I think it's a constant process of communication and answering people's questions.
We've also received a lot of questions about what people can do to protect themselves, and we've received a huge amount of questions on various things people can do. Dr. Vally, is it risky for our immune systems in the long term, for our bodies, not to be attacked by the various random viruses and germs we would normally be exposed to in day-to-day life? Now that we're using loads of hand sanitizer and washing our hands well and not touching our faces, does this make our bodies get a bit lazy when it comes to fighting off disease?
Yeah, look, an interesting question. I think we've got to separate out the fact that we're in a particularly unique situation right now that's not going to be the case forever. And so we have to adopt a whole range of measures that may not be the case, hopefully, past the end of the year. Hopefully, before too long, we'll start to ease some of these restrictions and we'll start to revert back to doing things the way we normally do. So I think we've got to make sure we keep that separate from what we might do long term. And the evidence is really interesting about the effect of having sort of day-to-day infections on priming the immune system. And, this is where this whole field of healthy bacteria has taken off in the last few years. So, yeah, I think, the shorter answer is that we've got to be careful that we don't go overboard and that we recognise that there are good bacteria as well as bad pathogens.
Sophie, another question we've received again, and something we've covered previously on this live stream, is about to what degree the coronavirus, is airborne. Now, I was having a chat with a friend during the week and we were saying how we sort of subconsciously and almost involuntarily hold our breaths if we walk past a stranger on the street. And there is this lingering question about, is coronavirus airborne? How far can it travel and how much of a risk does it pose? What is the current science telling us?
Well, I think, I think that all came, and there's more and more research coming out about what happens in terms of how far the virus can spread. It is airborne. There was a study out this week looking at people who were running and jogging and whether if you were next to someone who was breathing heavily and whether the virus could spread near you. I think that no matter what the latest papers are saying, the reality is that if we stick to those physical distancing guidelines, so staying far enough away from people so that you're not likely to get, within, if they do sneeze or cough or whatever else, that you're not likely to then breathe in the virus, then we'll be okay. I think we can get a bit too caught up with, how close do we really need to be? There's very clear guidelines. We do need to be keeping our distance, whether that's in the same house as someone, whether that's going for a walk, whether that's going for a jog. We do know that it's spread by respiratory droplets, and that's the number one thing to keep in mind. So it's not, the research that they did a while ago was in putting it into an aerosol and spraying it. Well, it doesn't really live in an aerosol like that. So we do need to just be mindful of that. The number one way we get this is through respiratory droplets. So that's why washing your hands, that's why staying away if you need to use a tissue or cough or sneeze, that you put the tissue in the bin and you wash your hands straight afterwards. So those basic hygiene measures will actually make a really, really big difference. And I think we can get a little bit too caught up on, oh no, it's going to be in the air, or how long is it going to last on surfaces? If we manage our basic hygiene and get that right first, that's going to make a big difference, I think, rather than worrying about, am I, standing next to someone who's too close to me.
Dr. Vally, this is a question we received through the ABC News Online portal. If you're in contact with coronavirus carriers in one day, for example, 4 different coronavirus carriers in one day, you don't realise at the time, are you at risk 4 times over compared to just being exposed to one coronavirus carrier? What do doctors mean when they talk about the viral load of a surface or a carrier?
Okay, so they're probably 2 separate questions. So in terms of the first question, the whole principle of social distancing is that we assume that we are carrying coronavirus and we assume that everyone else is carrying it. And so what we're trying to do is limit the risk or limit the probability that the virus can move from one person to the next. So clearly, the more people that you're in contact with, the more likely you are to get the virus. It's just a probabilistic equation. And so that's why we're trying to limit our exposures. So that's probably the simple answer to that first question. In terms of viral load, that just simply represents the amount of virus that you're carrying in your body. And so different people will carry different amounts of virus and will shed different amounts of virus. So shedding means they'll actually expel different amounts of virus. And so I think the science is not completely settled on the effect of viral load on disease severity, and that's understandable since we've only known about this virus for a few months. But in general, the more virus you've got in your body, which kind of is a measure of how well the virus is surviving in your body and replicating, generally you have more severe disease if you've got more virus.
Sophie,
And
one of
Dr.
those
Valley,
places... Sorry, go ahead, Sophie.
no, I was just going to say that was one of the issues. I just wanted to just reflect with Dr. Valley about some of the doctors and the medical staff that have died around the world from this illness. That was the suspicion was that it was because they had a higher level of viral load, and particularly in the early days in China when maybe people were not using as good personal protective equipment as they could have, or they didn't have access to it. That could have been a reason why they had a higher level of virus in their system. And so maybe, hopefully now that we're learning more about the virus, even though it is still pretty early days and we don't know everything, making sure that people do have the right protective equipment and will help doctors and medical staff at least to try to reduce their likelihood of getting the virus. And if they do, then definitely reducing their viral load. But it's a very interesting topic and it's a very interesting issue. And I think, Dr. Valley, this is your day-to-day thing that you do, but I think for the rest of us, we're certainly learning a lot more about how viruses work. And it's, even though we wouldn't like to be in this situation, it's certainly one of the upsides, if there's an upside, is I think we're all learning a lot more about health and viruses and how to protect ourselves.
Sophie, we are all getting an education, as you say. One question we received was, has worldwide distancing reduced the numbers of people catching the common cold or other diseases?
Well, I know, looking at some of the data, that the numbers for the flu are certainly on the lower end of the scale in Australia. So hopefully it will mean that we are getting fewer cases of the flu and fewer cases of people catching cold. Because if you think about it, if we're not going out on public transport, not mixing with lots of other people where you might pick up the flu and colds and things like that, it sort of makes sense that we'll have a lower rate of those things, which would be a benefit. One of the things that the authorities are really encouraging people to do, particularly in higher risk groups, is to get vaccinated for the flu, though, having said that, just so that people don't end up getting that double whammy of getting coronavirus and then also getting the flu on top of it. So while we hope that the numbers will be lower, we don't want to be complacent and think that, I'm not going to get the flu, because the reality is once the weather gets colder, that's when the flu season kicks in. And we've actually got the flu vaccine out earlier this year so that we can make sure to get people immunised in plenty of time.
Dr. Vally, Jody Harding and Muhammad Ali asked this question. For more information about the appropriate use of face masks and gloves, there's been some varying advice over the course of the past 6 weeks about how useful they are.
Yeah, so once again, they're probably quite distinct issues associated with masks and with gloves. Maybe I'll tackle gloves first because I think that's the easiest one. So one of the misconceptions is that if you just wear gloves, you're protected, but the bacteria, or the virus, can stick to the gloves just as well as it can stick to your hand. So if you're wearing gloves and then you're going about all of your activities the way you would normally go about it, there's absolutely no protection at all. So as Sophie mentioned in one of her earlier answers when we were talking about the cleaners, if you're wearing gloves, you want to be changing them quite often. And I know one of the advantages of wearing gloves when I was in the laboratory was it made it easier to keep your hands pathogen free, because we had a spray bottle that had 70% alcohol, and so that was just more convenient than washing your hands a lot. So gloves need to be used appropriately if they're going to offer any protection. And I guess the same principle is true for masks. So one of the biggest worries with the use of masks in the general community is that firstly they're not put on and taken off correctly, and that offers a point of entry of the virus if you are not wearing the mask properly in the first place and then not taking it off. They're also not effective if you don't change them regularly. If you're using one of these cloth masks that people are starting to use, they need to be washed daily, otherwise they're not going to offer any protection. So there's a whole range of issues around wearing masks properly. And I guess one of the other unintended consequences people think is that wearing a mask in the general community may give people a sort of bulletproof feeling and a false sense of security. And so, it still comes down to the basic principles of social distancing and good hand hygiene. You can't forget those rules just because you're wearing a mask.
Sophie, we got this question through ABC News Online as well. Data from the US suggests ethnic minorities are disproportionately represented in the infection figures. A similar pattern is emerging in the UK as well. So the questioner asks if there's a similar pattern being reflected in Australia. And we've heard a lot of concern, Sophie, haven't we, about this disease reaching Indigenous communities particularly.
That's right. Look, the data from both those countries and certainly from the US has shown that African Americans are definitely more likely to show up and have more serious disease and have a high level of mortality. There's been, Indigenous populations in Australia would also be more at risk because they have a higher rate of some of these conditions that can predispose people to have more serious illness, so higher rates of cardiovascular disease. And so the authorities have been very careful here to try to limit the amount of disease that can get into Indigenous communities. And so far, I think we've been doing a pretty good job because they're really mindful that if it gets into an Indigenous community, it could be absolutely devastating. And so they've been very careful to make sure we can take extra precautions that it doesn't get into those communities, because the last thing we'd want to see is what we've seen in some overseas countries where it has shown up and had devastating effects in those minority communities.
Dr. Vally, given we've never been able to produce a vaccine for the common cold, how can we be sure one can ever be found for this particular strain of coronavirus?
The short answer is we can't be sure. But I think we've moved forward in leaps and bounds in terms of our understanding and the technologies that we have to produce viruses. And so, there's never been more money and more time and more effort invested in producing a virus than what is happening right now. And we're seeing scientists from around the world work together in a way that they've never worked together before. And we've seen them also work with governments and even with industry. So if we're ever going to find a vaccine and find it in record time, it's going to happen now. So, we still have to be realistic that it's a very difficult task. And we probably also just need to not put all our eggs in one basket and just assume the vaccine's going to come by the end of the year. But I'm very optimistic. I think there's a lot of work being done. And of course, there are already vaccines being trialled right now. So, I guess we're all going to watch this space very closely.
Sophie, Chris Brown and Emily Rowe have this question. Can you catch coronavirus twice?
Look, that's a really good question. I think that the science is probably still not there. I mean, there's not a lot of evidence to suggest you can catch it twice. But as we said earlier, this virus hasn't been around for that long. We don't know how long people's immunity lasts once you've had it. So it's probably still too early to say definitively, no, you cannot catch it again, because we just don't know. And if you think about other coronaviruses, and I was reading an interesting interview with Professor Ian Fraser, who was talking about not only the vaccine, but also antibodies and immunity against viruses like this. If you think about like the common cold, which is a coronavirus as well, the immunity against that doesn't last for years either. So he says it's really more months rather than years. So if we look at it in those respects, then it's difficult to know how long someone would be immune from catching it again if they've had it once. So I'd say that the jury's still a little bit out, but there's no evidence to suggest strongly that you can catch it again or that you will catch it again. But I think it's a bit of watch this space, to be honest.
Dr. Vally?
Yeah, look, I mean, I think, we're all going to get used to answering questions saying we just don't know because we've only sort of seen this virus for a short time. But if I take the glass half full approach, I'll say that we know that for SARS, which is closely related to this virus, people have been shown to be able to produce antibodies to that 2 years after being infected. And we also know that this virus, despite it being an RNA virus, it's not mutating a whole lot, and certainly not mutating in the critical areas that elicit immune response. So I think there's a lot of good signs there that immunity could be, could last for a reasonable amount of time. So I'm going to be optimistic on that front.
Dr. Vally, this question comes from John Ashworth and Ricardo Anuvio from Facebook. How are people who've had the virus faring? Do they fully recover, or are there lasting effects?
Yeah, it's another good question. And I think, once again, we don't have a whole lot of data, but obviously most people who recover seem to recover fully. And that's similar to what we saw for SARS. So people who recovered from SARS seem to recover fully, and there are very few people that had long-lasting effects. So perhaps that's another bit of good news for people that do recover.
Sophie, this question from Taz Winkler. If we get enough medical resources on standby, so ICU beds, ventilators, etc., does that make the case for lifting restrictions so that things can go back to normal? Where are we on that curve of supply and demand, and where restrictions, physical distancing, sits alongside all of that?
Look, that is a really good question. And that's a question we've been getting quite a lot, because people are saying, well, look, they're seeing the numbers going down, that the number of new cases are going down. And then they're also seeing that the government's talking about we're doubling the number of ventilators and we're freeing up ICU, we're cancelling elective surgery. So if we're so prepared and the numbers are going down, why are we still having to, do everything that we're doing and staying at home? I think the clear indication from the government was that they're looking for a number of things to happen before those restrictions can be eased, and those things are part of making Australia as ready as possible for if and when we reduce the restrictions and there is a bump in cases, then we'll have everything ready, like the ICU beds and like everything ready. So the plan that the government's announced for the next few weeks is to really boost the amount of testing. So they'll be doing sentinel testing. They'll even be doing random testing to predict where the virus might pop up. The plan is for the increase in tracing. So the app that people might have heard about, which would look at sort of boosting the contact tracing that's already being done, but do it in a more digital way, obviously with privacy concerns that have to be addressed. And then look at the rapid response. So if there is an outbreak, say like there is in northwestern Tasmania, you can throw a lot of resources at it. You can lock down that area and make sure it doesn't spread. So it's making sure that all those things are in place, as well as having the capacity, like the ICU beds and the retrained doctors and nurses able to use those beds. We need all that in place before we can think about loosening the restrictions. So having the infrastructure and the hospitals on standby is just one part of the puzzle. The government's pretty clearly outlined what those other pieces of the puzzle are now, which is good. So we have a sort of clear things we need to work towards. And if we can get that happening, then I think we're more likely to have those restrictions released in the next couple of weeks.
Dr. Vally, Ian Middleton takes it one step further. He asks, why don't we aim to eliminate the virus altogether? Is that achievable in your view?
Well, I guess we'll find out. We have the perfect experiment, if you like, because that's the approach New Zealand are taking. And, they're similar to Australia in so many ways. And of course, we're taking the approach to suppress the transmission of the virus. So we don't know what the best approach is, and there's going to be a lot of analysis after we've taken care of this pandemic and these epidemics in various countries, to go back over the data and try and work out what the best approach is, so that we're prepared for, heaven forbid, next time this happens. So I think we don't know the answer. We know there's a huge cost to trying to eliminate the virus. It means we have to go even harder with our lockdown measures. And then, of course, we've got all the unintended consequences on the economy and various other aspects of society. And of course, if it proves too difficult and you've paid that price to try and go for elimination, where does that leave you then? So, if we knew the answers to these questions, we would obviously all be following exactly the same path. But there's just so many factors. It's a very good question and a very difficult one to answer.
Okay, just finally, before we let both of you go, Sophie, give me your hot tip about staying safe and sane in this period of isolation.
Well, look, it's not easy, Jeremy, and I think that's the thing to recognise, that we're all in this together, and we all need to be probably a little bit more considerate and compassionate, not only with ourselves but the people around us. So I would suggest, and what I've tried to do, is sort of lower your standards, and that doesn't mean just walking around in pyjamas all day. What that means is, if you're used to having, very high standards for everything, maybe you can relax it a little bit and take the pressure off yourself and off the people around you. And also think about how the language that you're using when you talk to yourself and when you talk to the people around you, because, we are in often close proximity to people for long periods of time. And so just being compassionate with yourself and with those other people. Also scheduling in, as we've talked about before, scheduling in connection outside your house or wherever you're living. So you're making sure to have those catch-ups online, to know that at the end of the day you've got something fun to look forward to. For example, we had an extended family catch-up last night on Zoom, which was really nice, and we're going to do it again next week. So just being able to see someone and connect with them, even if it's only for like 5 or 10 minutes, it can actually make the difference between a crappy day and actually a really good day. And also keep moving as well. We're allowed to go out to exercise for a short period, and I think for our physical health and our mental health, we need to take that opportunity.
Dr. Vally, we've been doing isolation for about a month now, and some of these soft skills about dealing with isolation are going to be very critical as this keeps rolling on.
Yeah, absolutely. And look, I think one thing that we've learnt over the last few years particularly is how important social connection is for our physical health as well as our mental health. So, I agree with Sophie. I think it's really important that we reach out to other people at this time to, improve our human experience of this very unusual event that we're all trying to navigate. So, check in with people that you think may be isolated and might benefit from some assistance. And look after your own mental health, because this is a difficult thing that we're all trying to navigate. But without overusing that cliche, we are all in it together, and hopefully we'll start to see some easing of restrictions sometime soon.
Okie dokie, my friends. Dr. Hassan Vally, Sophie, Scott, thank you both for joining us, and thank you to our viewers too for sending us your really fantastic questions. Sorry we couldn't get to all of them, but we will try to again next week. So join us same time, same place to put your questions to the experts. Thanks for joining us.